Okay, hello. So we interviewed Catherine Alokta, and she has worked in the recreational therapy field for more than 20 years, and she currently works at the National Institute of Health Clinical Center as a recreational therapist and a clinical manager for inpatient and outpatient rehabilitation programs. So in this 5-minute discussion video, we're just going to be answering the questions that she provided for us in the interview. So Brenna can start with the first question.
So the first question that we have written down is tell us about your recreation or your professional role in recreational therapy. What settings have you worked in? What attracted you to RT? And why have you remained a CTRS for 20 plus years? Catherine Alokta answered by saying she first did her residency at Thomas Jefferson Hospital, but she had told us that she doesn't have much experience with pediatric care, but she still covers in pediatric centers on occasion. She's worked with patients with physical disabilities and worked in rehabilitation. She was attracted to recreational therapy due to people's individuality with their disabilities. She likes to feel like she makes an impact on her patients' lives. She has remained in CTRS because she loves the variety and the challenges. She loves working with patients individually. She was attracted to recreational uh sorry. Um sorry. But one of our favorite quotes that she said during the interview is she helps people live, not exist.
Okay, and then the second question that we asked her was, how does your current position contribute to the recreational therapy? Now, I already mentioned this, but she's also a clinical manager for inpatient and outpatient rehabilitation programs. So she also conducts interviews, like how we interviewed her, and she basically just goes through the process of finding people to work at the NIH center. She also said that she has to be creative and understanding in the personalized interventions for the patients she works with. So she takes a lot of time out of her day to think of ideas to interact with her patients and assess their deficits or impairments.
So the next question that we had asked was, we've learned about some of the different definitions of recreational therapy. Can you tell us what your definition is? And Catherine had said, what makes something therapy is that a person is evaluated to have a deficit or reduced function depending on some standard that's measured, and then an intervention based upon research to reduce that impairment or deficit or improve function. That same area is reassessed after the intervention to see if it was effective. Recreation is the modality or area of intervention that is utilized to achieve that outcome. That was her definition.
Okay, and then we also asked her, or we also said that we were learning about the API process. So we asked her what did the API process look like for where she worked, and why does she think the API process is important to recreational therapy practice. And she basically said she answered it previously, but that there's a separation between correlative and causality. So she said for the process, it looks like usually on a daily basis, they're given a referral by a licensed provider. So that being a nurse practitioner or, yeah. Also, she said that someone is legally able to prescribe the referral. Then, after they're given the referral, the recreational therapist then assesses the patient in every domain. So that could be in motor function, physical skills, or impairment skills. Also, she said for the API process, the sessions vary. So sometimes they're in different time increments. So it's different for every patient. Also, the patient discusses the area of concern for their challengement. So they help to acknowledge in that and try to assess their impairment or deficit.
So the next question that we asked was, what does the future of recreational therapy look like? And she said that it will continue to change. She said she's not too sure, but there will be more private startups that individuals will need to provide direct service, more telehealth and directing people through electronic mechanisms. Traditional pieces in RT will become more scarce and rare, which she had mentioned is sad to her.
And then the last question we asked her was, what advice does she have for future recreational therapists? And in that question, she basically just overall summarized how to prepare ourselves for interviews and research to see what the overall mission of that organization is, and to also do our homework beforehand and practice. So always do dry runs and be professional when going to the interview. And then she also mentioned before we apply that we must understand as much as we can about the organization and of that department because we want to know what we're getting ourselves into when we do try to work for another organization as future recreational therapists.
Catherine Ologda was really fun to interview, and we really enjoyed interviewing her. Thank you.